Representative Coulter, to your bill.
Excuse me. Thank you, Mr. Chair. Well, to begin with, stop me if you've heard this before, but I'm here today to talk about an enrollment decline. Instead of talking about specific colleges or universities, though, we're talking about folks becoming paramedics. You all have in your packets a handout detailing the challenges that are facing emergency medical services in Minnesota. And the number that I want to specifically draw your attention to is on the back. Nearly 3,000 more EMS provider certifications expired than were issued. House File 165 specifically deals with paramedics, but it's a similar story. Barely half as many graduates took the paramedic exam compared to the number of certifications that have expired. House File 165 takes aim at part of that issue by establishing a paramedic scholarship program administered by the Office of Higher Education. This would be funded by a one-time appropriation of $3.2 million, with $3 million of that going to up to 600 scholarships for an average scholarship of $5,000. So with that, I will turn to my testifiers who can speak more directly to the need for this bill.
Welcome to the committee. Please identify yourself for the record.
Mr. Chair and members, Buck McAlpin on behalf of the Minnesota Ambulance Association. Thanks to Representative Coulter for carrying this bill. Again, as I look at some folks like Representative Davids and Representative Pulowski, our ambulance industry would be in a lot dire consequences without the long-term support of this state legislature. We have some of the highest Medicaid rates in the country. This group's always stepped up over the years to fund us. We were working before COVID, Mr. Chair and members, in a rural sustainability committee as we saw this decline starting to happen. Old paramedics like me with gray hair that were just leaving the profession. And we worked pretty hard on solutions and we're coming up with ideas. And then COVID hit, which, as you've probably heard in other committees, has really impacted the EMS community. It's sad to say there's probably parts of the state today we probably have a hard time of an ambulance even responding to someone's call appropriately, where some of our volunteer services are. So our statute changes over the years on the EMS Regulatory Board have allowed us to use part-time paramedics, bring very advanced medical care to rural Minnesota and not only to large communities. And besides, there's 2 levels of practitioners, emergency medical technicians. We have legislation also to fund that. Right now there's a program through the Regulatory Board to reimburse for that training and for some first responder training. And the paramedic side is one we have to focus on too. And we thought for sure we'd bring this. We did bring it forward last year and had good hearings at the end of session that didn't get done. But as we look at what I think Mr. Ferguson will come up next from the Regulatory Board and talk about is we have to have some real significant discussions around funding to try to get folks in. Many of the smaller ambulance services, or even some of the large ones, are offering these grants out of their budgets now that most of them are operating in the red, trying to pay even for people in internship programs to become paramedics across the state. The community college up by Moorhead just canceled their community paramedic program. Out of 30 open slots, they only had 2 people apply for it. And that's a little concerning as we look about what we think people should have access to is an ambulance, police officer, sheriff, or fire department that shows up in an appropriate time. So we appreciate your support from this statewide, from our association and Representative Coulter. And if Mr. Ferguson could come up and talk about some of the data, I think it's pretty interesting as they've worked hard to really identify the problems for us.
Mr. Ferguson, welcome to the committee, and please identify yourself for the record.
Good morning, Chair Pawlowski. My name is Dylan Ferguson, Executive Director for the Emergency Medical Services Regulatory Board. As an EMT for the last 18 years and a paramedic for the last 13, I know the importance of making investments into the emergency medical services workforce in helping to ensure an adequate pipeline of individuals interested in a career in emergency medical services. Over the course of the last year, the MSRB has been working closely with a variety of different stakeholders, including the Ambulance Association and legislators, to try to identify strategies to reverse a worrying trend within EMS, with professionals leaving at a rate exceeding what they can be replaced, as the fine representative had highlighted. EMS is an intricate system of different levels of providers, ranging from community-based EMRs that take a 48-hour course to EMTs that take a 180-hour course, all the way to the level that we're talking about today of paramedics, which take over 1,000 hours of training over the course of 1 to 2 years. These individuals undergo training in administering numerous medications and advanced clinical procedures to wherever they are needed outside of a hospital's walls in Minnesota. As of today, there are a total of 3,827 paramedics to go around the entire state of Minnesota. Of that being said, only about 80% of them are actively practicing clinical medicine in the back of an ambulance. So as a result, paramedics are in heavy demand, both in metropolitan areas, but also, as Mr. McAlpin had mentioned, in outstate Minnesota. But the demand for these highly trained, qualified, and credentialed practitioners far outpaces the available supply. Much as what we have seen both in cases of nursing and nursing assistants, which we have seen some previous scholarship legislation that had significant positive impacts. It's my hope that Senate File 15, that the bill before you today of House File 165 will serve as one tool in a toolbox that needs to continue to grow even beyond the bill before you today, but is a wonderful step in the right direction and is also a step towards helping us ensure that the diversity of our EMS workforce is reflective to the communities which they serve. In 2015, EMS education programs across Minnesota created 160 new paramedics. For calendar year 2022, that number fell to 125 new paramedics, which means a 22% decrease in the number of paramedics that we were able to create within our own borders here within Minnesota. Complicating this fact, when it comes to paramedics deciding to leave the field, from 2018 to 2021, on average, 190 let their certification expire for each of those years. So at a simplified level, every year we lose 65 more paramedics than what we're able to replace. Most concerningly, 50% who let their certification expire are under the age of 40 years old, and a staggering 20% are under the age of 30. The inability to recruit more paramedics and to retain younger paramedics leads to workforce challenges and a workforce that increases in age each year. And presently, nearly a quarter of all of our certified paramedics in this state are over the age of 50. As written, this bill would help remove one of the largest barriers of EMTs from upgrading their skills and their certification: cost. With over 1,000 hours worth of material and activity to cover, the costs of education have increased just as it seems the cost of everything has gone up each year. It's also important to note that EMTs, from where our paramedics come from, are also one of the lowest paid, when they're paid at all, when it comes to healthcare professionals. In fact, 1/3 of all EMTs who left the profession reported pay and compensation being an influential factor to their premature departure. With all this being the case, it's not difficult to assess why they're not advancing to the paramedic level. House File 165 would help remove some of those barriers and allow our emergency medical technicians to be able to upgrade their skills and fill an ever-increasing need across the state without wondering how to pay for that associated training. It's for all these reasons that I ask for your support and consideration for holding over House File 165 for inclusion in the omnibus. Mr. Chair.
Thank you. Representative Davids.
Thank you, Mr. Chair. Mr. Ferguson, how does Minnesota compare on their training and qualifications for EMTs versus EMS with other states? It seems a complaint that I get from a lot of my constituents that are in this field is that the demands are just so amazing. I don't know, are very restrictive, very tough. And I want my EMT to be very well trained, believe me. I'm not saying that, but how do we compare with surrounding states on number of hours, qualifications, things like that.
Mr. Ferguson.
Mr. Chair, as it relates to Minnesota's qualifications for those courses, first I'll address at the emergency medical technician level. Minnesota uses the National EMS Education Standards, which are promulgated by the Office of Emergency Medical Services within the National Highway Transportation and Safety Administration as a part of an interdisciplinary group. And then for their credentialing point of view, all of our EMTs take what is referred to as the National Registry of Emergency Medical Technicians examination. This is a pathway which is utilized at the EMT level, I believe, by 44 of the 50 states. The other aspect that I feel it's really important to highlight is because we use those national EMS education standards, there is no longer a minimum number of hours, Representative. It used to be that courses, no matter how they were ran, an EMT class had to be 120 hours, period, full stop. There is now utilization more of a competency-based approach where there's a list of competencies, and if a program can complete it in 180 hours versus 160 hours versus 200 hours, it can really be tailored by that program to the needs of their specific community. But the other thing that I will also highlight is the number of hours has gone up time over time, and that is really twofold. The first relates to expectations from the community. As we take a look at TV shows, like for some of you growing up may have remembered an old show called Emergency, which covered the antics of firefighter paramedics Johnny and Roy out of LA County, Squad 51. To even more recent shows such as Night Watch, which covers New Orleans EMS. And the public sees these advanced skills on TV, and that is what their expectation is now, right, wrong, or indifferent, of when an ambulance arrives. What we would refer to generally as a scope of practice for an EMT has significantly expanded over the course of the last 20 years. Here in Minnesota, we do not have a state-defined scope of practice. Those decisions are made at a local level by individual EMS agency medical directors. However, even our EMTs are providing more medications and providing more interventions than at any time in Minnesota, or really it can be equally applied across the country. From a paramedic perspective, I can apply most of the same logic. The only thing that changes, Mr. Chair, would be the fact that I believe it is 48 states utilize the same methodology and the required accreditation from the Committee on Accreditation for the EMS Profession. So that would be my answer, and I hope that that's a sufficient explanation, Representative Davids.
Representative Davids.
Thank you, Mr. Chair, and thank you for that answer. That was very helpful. We have a crisis here in EMS, EMTs, and it's very, very severe. And Mr. McAlpin has been in my office many times trying to figure this out. I've been working on this since the mid-'80s as mayor of a small town, and since I entered the legislature in '91, have worked on it over the years with Roger Cooper and Representative Pawlowski and others. This is a very serious thing. This is one thing I think we could do to help, but there are other things we need to do too. For example, in several of my tax bills, I put tax credits in to give stipends, additional signing bonuses to folks that will sign up for EMT classes. We're trying to think outside the box, and this doesn't solve everything, but I think this really helps. And I want to thank Representative Coulter for this, and I know with Representative Pawlowski and I going to our Tri-County firefighters meetings in the Southeast, we are in a crisis mode right now, and I'm hoping, Mr. Chair, that I know this is being laid over, but I'm hoping we can work on this and other issues to help our EMS service. Thank you, Mr. Chair.
Mr. Ferguson, Representative Coulter, I have a concern in Section 2, lines 2.21 to 2.29. Can you explain how these numbers were arrived at? The 3.2 million is a overall number, and then the breakdown? Mr. Ferguson?
So in taking a look at, and I wasn't directly involved with the crafting of this legislation, but in just reviewing, if I may, Representative, in reviewing the language, when we took a look at what the tuition of different paramedic programs are across the state for just a base, as a base, not including some of the prerequisites which may be required, we were finding that those scholarships were in the area of $5,000, right? So that was the kind of average tuition across the state. In trying to jumpstart some of this, the goal, it looks like, was to try to identify, up to 600 students for the 24-25 biennia. So when you took that 600, multiplying by that maximum $5,000 scholarship, looking at what that need was, that's how it appears that base of $3 million was established. And obviously, we recognize that the Office of Higher Ed, in order for them to administer this program, that certainly there's going to be some costs in making sure that scholarships are awarded in the manner consistent with the statute, and making sure that all reporting requirements and all fiscal requirements, because obviously from previous questions of this committee, that's something that's very, very important. And then lastly, it's important, it's going to be a requirement to try to make people aware of this program, right? Because if there is not if there isn't an awareness of the program, or trying to encourage people, our current EMTs, to upgrade and take that paramedic course, then that would just basically be money that would have been set aside for no good reason. It would go unused and would ultimately lapse back to the general fund, which is something that we really want to avoid. We want this program to do a lot of good. So, Mr. Chair, in reviewing those amounts in Section 2, that is how I would identify that those came to be, with the specification that those funds has to be expended by June 30 of 2026, or when those funds were exhausted, whichever would occur first, Mr. Chair.
Mr. Ferguson, I appreciate the explanation, because I share the concern of Representative Davids in the regard to how this program is going to work. We are in a desperate situation here across the state, and I'm hopeful that you've picked the correct numbers and the correct approach. So I appreciate the bill a great deal. My concern is always over how these numbers are selected, and I would hope that it would work. Representative Scott, did you have a question?
Yes, thank you, Mr. Chair. And I'm just curious, based on the testimony about the pay that our emergency medical folks receive, is there going to be enough incentive for this program if the pay is not that great on the other side if they complete
Mr.
the
Ferguson.
program?
Mr. Chair, as it relates, and that is actually a wonderful question, Representative, and it is also somewhat part of a challenge. So with having different levels of expertise within the EMS system, EMRs, EMTs, paramedics, different reimbursement rates for ambulance services based on whether advanced life support care is provided or basic life support is provided, there are different salaries for an EMT or a paramedic. A paramedic will typically make a little bit more than an emergency medical technician, yet current salary kind of tracking both by Minnesota DEED and also the U.S. Department of Labor kind of collapses both EMTs and paramedics into the same pay structure. So I can tell you that I would say that on average an EMT is probably looking south of $30,000 a year, and a paramedic, looking back at probably 2018 data, you're probably more in the neighborhood of $30,000 to $40,000. So there would be somewhat of a financial incentive for someone to promote from being an EMT to a paramedic. However, when you are responsible for paying for that education for yourself, it is very difficult for them to be able to make that investment in themselves on the salary that they're currently making, particularly if they're already, as I did growing up in Illinois' EMS system. I had to work part-time for 9 different ambulance services to put myself both through paramedic school and also complete my undergraduate. So this is a case where I believe if we would remove that financial barrier from the individual student and try to remove that financial barrier from the employers that they currently work for who really do not have those extra funds, particularly in the outstate, to be able to support those educational ventures, I do think that there would be that incentive to do so. I think there are a lot of EMTs that this is just a barrier for them, both from a cost perspective and also from a time perspective of just making sure that they're able to provide for themselves and their family. Mr. Chair.
Representative Scott.
I guess one of the questions that pops into my mind based on what you just said was, and maybe you have a breakdown of this, you have a really good grasp of all the data inside of your head, which is awesome. How many of the EMTs in Minnesota right now, if you know, are only part-time? How many of them are full-time? With the definition being maybe they're working more than one part-time, maybe they're working 2 part-time gigs to make the equivalent of a full-time. So what I'm getting at here is, $30,000 to $40,000 a year isn't going to get you much in most areas of the state as far as, a standard of living. And so, like in outstate, for instance, it would be much harder to have more than one part-time gig as a paramedic because there's probably only one provider in town. So you kind of get what I'm getting at.
I do, and that is, sorry, Mr. Chair.
Mr. Ferguson.
My apologies, Mr. Chair. Caught myself, but barely. So as it relates specifically to the question of having a full-time or a part-time breakdown, unfortunately, those are not statistics that are currently collected by the EMS Regulatory Board. It's not part of our data set. But what we take a look at, though, is we have somewhat of a breakdown of volunteer providers versus combination employers of maybe they pay some people, but they volunteer others, or versus all volunteer organizations. And one of the things that we've noticed is year over year, the number of services and the amount of transports that are having to be covered more by paid employers or by all paid EMS agencies does continue to stay somewhere in that 79 to 80% of volume. The number of all volunteer organizations continued to decline. And speaking to the point of, there may not be that many places to be able to work. There are certainly several EMS providers who will travel from one side of a county to the other side of a county. If they're not already working 20, 30, 40, 60 hours of overtime to ensure that all the ambulances that are needed with the community are staffed. So I don't have the exact figure that you're looking for, but that is what I would offer as a substitute that I do have, Mr. Chair.
Representative Scott. Thank you. Mr. Ferguson, this is for students entering the program. Is there something available for current EMTs that could help them offset certification costs that are already in the system?
Mr. Chair, at the EMT, at the emergency medical technician level, the answer to that question is yes. The Emergency Medical Services Regulatory Board administers a program in which we can provide reimbursements for their continuing education courses. However, the existing statute is very strict. It only allows us to provide that reimbursement to what are referred to as volunteer ambulance attendants. So they essentially can't make more than, I believe it's somewhere in the neighborhood of somewhere between $6,000 and $8,000. If they make over that, or if they're at any other level other than an EMT, they do not qualify. We have been trying to work with other legislators and other committees to potentially look at expanding that program to allow, an increase to those amounts that are currently reimbursed, because they have not kept up with the cost of education, as they haven't been addressed probably since the late 90s or early 2000s. And as I said, it's restricted only to that EMT level. So really, there really is no state assistance once you have departed that EMT level. Mr. Chair.
Mr. Ferguson, I've just got one follow-up. Which committee would be in charge of that account?
Those types of bills, Mr. Chair, would likely be the jurisdiction of the House Health Policy and Finance Committee, Mr. Chair.
All right, thank you. Representative Davids.
Thank you, Mr. Chair. Just a brief follow-up. I like this bill, and we can work the numbers and make sure that they work. But like I said, it's very, very serious right now. We have, and this is not this bill, but we have situations across the state, especially in rural Minnesota, where the infrastructure for ambulance buildings, and that's not for today, they're crumbling. They're crumbling. And I have several bills that we'll be looking at in the tax committee to allow communities to basically sales taxes for the communities for ambulance buildings. Because they're very, very important, because we really have to watch out that communities don't start coming to the legislature for bonding for these buildings. Because if we start doing that, we're going to be building 900 ambulance sheds, and I don't think we want to go there on the bonding side. But again, I support this bill. Mr. McAlpin, thank you for everything you do here. And to Mr. Ferguson, I wish you had your facts a little more in order.
Mr. Chair, I appreciate the sense of humor.
Mr. Chair, and for the record, that was, as my grandson would say, Grandpa, I won't tell you what he says.
Now we need to know.
Yes, now you know. So no, you're amazing testimony, and I really appreciate it. Oh, he says, Grandpa, is that sarcasm? 8 years old. Is that sarcasm? I say, yes. Sam, that's sarcasm.
Representative Coulter, we're in possession of the bill, and should you need to change those numbers, let us know.
Thank you, Mr. Chair. And that actually was the exact point that I was going to make, because I'm happy to continue that conversation with other legislators, with OHE, about what the exact numbers look like. I think
And
that's
Mr. Ferguson,
absolutely
you should let some of us know on the progress of those other bills. We would find, we offer support.
I thank you for your support, Mr. Chair.
Thank you.